Good morning, everybody. Hi, Dr. Erica here. I am back from a fabulous weekend in New York City, and I was at the International Chiropractors Association Council on Pediatrics conference. And this is a conference that I and my fellow diplomates in chiropractic pediatrics must attend in order to maintain our board certification in the specialty of pediatrics and prenatal care. So it was a very exciting. We missed some of you doctors out there this time around, but I know folks are really busy and don't always get to go with us each time. I was asked to give a couple of shorts about what they covered during this conference. It was a 14-hour conference, so I don't feel like I can adequately give you everything for sure, but I figured I'd at least pick one subject at a time to share with you in a little nutshell so you can appreciate a little of what we learned. So I was looking through the papers this morning, and there were some dynamite papers, by the way, being presented from not only America, but also Canada and other places as well. It truly is an international organization, which I think is just great. And I picked this morning a paper which is called An Ambiguous Response to Chiropractic Care of a Child with Congenital Torticollis, a case report. This paper was submitted by Dr. Dolbec, and she is, I believe, French-Canadian. And this case is of a little child who came into her office with torticollis. The first thing to know is, what is torticollis? Torticollis is a condition typically found in the neonate or the child where the child develops what we call a lateral tilt, a side bending of the head, and a counter rotation like this of the neck. And there develops great spasm and pain in the muscles in the neck here. And they always kind of look thoughtful, these kids. Their heads are kind of always tilted to the side like this. How does one get torticollis? That's a good question. There are a couple of different methods. One is in utero lie. You know, when you are bent up in the shape of a paperclip for several months inside mom, sometimes the head gets cocked in one way or another and can't sufficiently resolve before birth. So that's one way. That's called congenital torticollis. Another way is positional, meaning that a child is constantly put in one position and the head stays like this, stays like this, stays like this, and then it cannot be resolved. There's also traumatic torticollis, which is when at birth, due to perhaps a speedy delivery or a less than finesse delivery, the head and neck are twisted and pulled in a way that results in injury. I have even seen cases of torticollis which were brought about by illness. For example, strep throat is one thing I've seen. Learned a little bit about this by Dr. Barry Sunshine down in Tennessee. He talked about the infectious related cases of torticollis. But in any case, in Dr. Dolbec's situation, she has a little one who has a left-sided torticollis, like this. And she also talked a little bit, before I get actually into the condition, this is also important, so I'm going to backtrack, I'm sorry, one second. So she is in Canada, and as you may know, Canada has national health care. And while some feel like that is a really awesome thing, everyone should have access to health care, and in general I agree. But one of the problems in Canada is that it is very difficult oftentimes to have coordination between physicians and to be able to get lab tests, x-ray reports, and other things in a timely manner. And for her, that really created a problem with this case because she has a child with this torticollis. Testing has been done to see what's going on, and she has no access to it. Or at least the access takes so long that it actually might create a problem for the child if this is not a simple condition. And so she expressed some of the frustration around this, and I think that's important to note. Just because you have access doesn't mean that you have ease and applicability. So she, I believe it was actually her associate, who looked at this child and determined that this was torticollis, and they treated the child with chiropractic adjustments to the spine to correct the alignment of the neck, and also, excuse me, gave the parents an at-home exercise regimen to help maintain the results. Everything was going super good. I'm just checking in my notes here. They saw the child about 3 times, feeling much better, and then something happened. They don't know what happened, but the mother called and said, my child is worse than when I first brought him in, and what's going on, and was really very upset. Wasn't angry at the doctor, but was just very, very concerned. So at this point, the doctor was really very worried because, again, they could not get access to the imaging and to the blood work that was being done. They were only told rudimentary things like, there was an inflammatory response, a sed rate was increased, which really doesn't tell you a whole lot. It just says the body's inflamed. Well, no kidding. Look at the kid's neck. It's like this. There's all kinds of spasm and pain and all kinds of things. But it doesn't tell you why. So anyhow, they brought this little one right back into the office right away, and certainly the child was much worse. So what Dr. Dolbec was interested in is, aside from being very worried about the child, was very interested in why did this come back? Everything was good. They examined the baby, they adjusted 3 times, everything was doing terrific. What happened? So one of the interesting things here that kind of made me want to talk about this is that there were some things that happened between that last visit and when the child got worse. And a couple of things happened. One is that the child was vaccinated between those visits. Another was the child had an upper respiratory infection as well, and was teething. Poor kid, It's bad enough your head's like this, but also you get an introduction of a toxin, you're sick also, and you're teething. So this kid had all kinds of background things, not related even directly to the chiropractic care, which caused an acute rise in inflammation and a return of the torticollis. So the chiropractor kept adjusting and providing manual therapies of different kind. They continued with exercise, and it resolved within a few visits. So there's several important things about this paper, which I thought was excellent, by the way, that history is really important. You need to be able to communicate properly with the patient. Not only are there any language barriers and things like that, but also are you able to get the history of testing? Is it available and is it applicable? And the other is to look at what things in the environment may be affecting the success of the care. There's a triad of health in chiropractic. So imagine a triangle, like this. One side is structural health, one side is chemical health, and the other is emotional health over here, right? Structural health, this side, is the alignment, okay? The alignment of the bones, the health of the structure overall. Chemical has to do with things that we are exposed to the environment, like our food, medications, pollutants, those kinds of things. And then the emotional side is very obvious too. This has to do with stress, good, bad, whatever it is. All 3 of these parts of the triad affect health. So here you had a child who was already structurally having a hard time, got structural care, did better, but then this part, the chemical part, became unbalanced. Vaccine, infection, and teething. And those things together, it seems, overwhelmed the ability of the body to adapt and caused a reoccurrence of the torticollis. I think, I think Dr. Dolbec and her associates did a very good job on this paper and a really excellent job of working with this patient It's scary when you have a patient who's doing great and then all of a sudden not doing great. And particularly if you're a young doctor and you see these things, it can be scary. We're only human after all, right, as the song goes. So I want to put it out there to Dr. Dolbec that I appreciate your work and your paper. And that is the deal. Does anybody have a question or anything before I sign off today regarding this study about the ambiguous response to chiropractic care of a child with congenital torticollis? Anybody? Okay. Well, thank you very much, everyone, for listening, and I hope you learned something today. I know I did when I listened to the paper, and I'll be back with more soon.